New information on the opioid crisis here in our country that we have been following very closely here on Happening Now. And alarming new data showing that close to 1 in 16 surgery patients actually become chronic users of opioids after their procedure. Our next guest has a solution to address this emergency. Doctors should stop over-prescribing opioids. Dr. Marty Makary is a cancer surgeon and also a physician at Johns Hopkins. He's also the author of Unaccountable. Thank you very much, Doctor, for talking to us. Good to be here. There are some scary facts behind the world of medicine. Why don't you explain to our viewers the amount of opioids that you yourself as a surgeon was recommended to actually prescribe to your patients and one that you ignored?
Well, not only are we given too many, but we're given too many pills within each prescription. We give 250 million prescriptions out. That's crazy. And when I was a resident, I was taught as a surgical trainee to give out 60 or 90 tablets to everybody, almost regardless of which operation they had, because that way they wouldn't call us and bother us. And honestly, a lot of it was well intended. We wanted people to be comfortable. We didn't realize that 1 in 16 got addicted.
I mean, you are proposing a different strategy to combat the opioid crisis.
Well, I had my aha moment when I saw my father a few years ago have gallbladder surgery and recover comfortably after 1 ibuprofen. And at that time, was giving, and most of my 15-year career, 60 or 90 tablets, depending on the operation.
And that's per patient? Per
patient. And that is just a fraction of those 250 million prescriptions we give out every year.
How many pills would it take, if I started taking them, would it take to become addicted? How little do you have to take in order to become an addicted?
I think a couple pills is when people realize the effect it can have on them. If someone has a standardized C-section, that is, they don't have a chronic pain syndrome, best practices are to give a couple to maybe 5 pills. At Johns Hopkins, that's our best practice from our pain experts. 5 pills in combination with NSAIDs and acetaminophen, what they call multimodality therapy. We should be rewarding doctors and reimbursing for best practices with state-of-the-art multimodality therapy, not just injections and giving out pills.
It's just unbelievable that you were told to do 60 to 90 when you're telling me that it only takes a couple to become addicted. And there are a lot of other medicines out there that can be used to treat pain.
There's a lot of talk about treatment, but to be honest with you, most patients relapse. Treatment doesn't work well. The best treatment is prevention. If we're giving out 250 million prescriptions every year, can we look at the data and see which prescribing patterns are out there that we can rein in? I mean, we can take care of our own house, and with peer benchmarking and showing doctors their data relative to best practices, we can rein in people just like I reined in myself when I saw my father.
So now talk about the funding. Is the funding there in order to help these people who are now suffering from addiction?
You know, it's a tough problem. Once you're addicted, it is a tough problem. The relapse rates are as high as 91%. We're talking about adding more funding in some of the bill proposals that have been out there. But the reality is, can you imagine a society where we as doctors are giving people loaded heroin syringes in their homes and they're not using most of the pills we prescribe?
All right. Dr. Marty Makary, thank you very much for talking to us.
Good to be with you.
Appreciate it.